Tetanus prevention and treatment. Tetanus, also known as lockjaw, is a serious bacterial infection caused by the bacterium Clostridium tetani. The bacteria typically enter the body through a wound or cut that is contaminated with soil, dust, or manure containing the bacteria's spores. Once inside the body, the bacteria produce a toxin called tetanospasmin, which affects the nervous system. Here are some key points about tetanus. Symptoms. The symptoms of tetanus usually appear within a few days to several weeks after the bacteria enter the body. The most common symptom is muscle stiffness and spasms, particularly in the jaw, hence the name lockjaw, neck, and abdominal muscle. Other symptoms may include difficulty swallowing, muscle stiffness and pain, headache, fever, sweating, rapid heart rate, and high blood pressure. Complications. Tetanus can lead to severe complications, especially if left untreated. The muscle spasms caused by tetanus can be intense and painful, and they may interfere with breathing and swallowing. This can result in respiratory problems and even suffocation. Additionally, complications such as fractures, pulmonary embolism, and aspiration pneumonia can occur due to the violent muscle contractions. Prevention. Tetanus is preventable through vaccination. The tetanus vaccine is often given in combination with other vaccines, such as diphtheria and pertussis, and is commonly known as the DTaP or Tdap vaccine. The vaccine is typically administered in childhood as part of the routine immunization schedule and requires periodic booster shots to maintain immunity. Proper wound care, such as cleaning and disinfecting cuts and puncture wounds, also helps reduce the risk of tetanus. Treatment. If someone develops tetanus, immediate medical attention is crucial. Treatment usually involves wound care to remove any contaminated tissue. Administration of tetanus immunoglobulin to neutralize the tetanus toxin, and the use of medications to control muscle spasms and pain. In severe cases, hospitalization in an intensive care unit may be necessary to provide supportive care, such as breathing assistance, nutrition, and hydration. It's important to note that tetanus is a rare but potentially life-threatening infection. Following proper wound care practices and maintaining up-to-date vaccinations are the most effective ways to prevent tetanus. If you suspect you or someone else may have tetanus, seek medical help immediately. Let us know details about most common vaccine tetanus toxoid, TT. Tetanus toxoid is a component of the tetanus vaccine. The preferred injection site in older children and adults is the deltoid muscle in the upper arm. It is an inactivated form of the toxin produced by the Clostridium tetani bacteria that causes tetanus, left hand, by intramuscular route. Tetanus toxoid is used to stimulate the immune system to produce antibodies against the toxin, providing protection against tetanus. When a person receives a tetanus vaccine, they are typically given a combination vaccine that includes diphtheria, tetanus, and pertussis, whooping cough. The tetanus toxoid in the vaccine stimulates the body's immune response to produce specific antibodies that can neutralize the tetanus toxin if the person is exposed to it. Tetanus toxoid vaccines are usually given as a series of shots over time, starting in childhood and continuing through adulthood. In many countries, the vaccine is administered as part of routine childhood immunization schedules. Booster doses of the vaccine are recommended every 10 years to maintain long-term protection. It's important to receive tetanus toxoid vaccinations to prevent tetanus, as the disease can be life-threatening. Additionally, if someone sustains a wound that is potentially contaminated with tetanus bacteria, a healthcare professional may administer a tetanus toxoid booster shot as part of the wound management to ensure protection against tetanus. It's worth noting that tetanus toxoid vaccines are generally safe and effective, but like any vaccine, they can have potential side effects. Common side effects may include mild pain, redness, or swelling at the injection site, and sometimes mild fever or body ache. Severe allergic reactions are rare but possible. It's recommended to consult with a healthcare professional for further information about tetanus toxoid vaccines and their administration. Like, share, subscribe.